Conversation. It's going to be interesting. Okay, got it. Physically, mentally, emotionally, and work really hard on being good at you.
Healthy mind, healthy body, healthy life. Soul Food on Smooth 98.1.
Okay. Love music and love life. We are Smooth 98.1, 4 minutes past 8 o'clock. It's now time for Soul Food right here on a Saturday because that's when you get to enjoy soul food on Smooth 98.1. It's time for you to be educated about one thing or the other. And like the intro said, feed your mind and the rest will follow. That's why we discuss issues that are not just about your physical health. In fact, the World Health Organization has already defined health to be encompassing from the physical to the emotional to the mental. So, in other words, no health without mental health. That is why we are talking about this on this day. It is bipolar disorder. Now, you might have heard it before. In fact, I think I was in a conversation where somebody threw it around carelessly and said, "Why are you acting like you have bipolar disorder?" Simply because the person said something in a minute, and the next minute they said something else, which seemed to contradict. And the person said, "Why are you acting like a person who has bipolar disorder?" And I'm thinking, do you know what that is? So that is what we want to understand this morning, what bipolar disorder is. And before I go to introducing my guest, first you can join the conversation on YouTube and also stream live via the website. YouTube is youtube.com/smooth 981 FM Lagos. Again, smooth 981 FM Lagos. That's the channel you're searching for on YouTube. Click on the subscribe button. You can drop your questions or comments in using the live chat option. And then you have the call line the same, the WhatsApp line the same. That said, you know him. You can easily call him our favorite clinical psychologist on Smooth 98.1. And it's been always good having him discuss and enlighten us on different mental health topic. I am referring to clinical psychologist Chris Abojei. Good morning.
Good morning. It's a pleasure to be here as always. Thank you.
Always a pleasure. Thank you for always obliging us and being here. So let's get started with what exactly bipolar disorder is.
Okay. Well, thank you. Thank you for choosing to talk about this. Because like you, sometimes I see some of those things flying around, bipolar, and all those things. And most times I realize that people don't really know what it means. So I think when people think about bipolar, they should look at it from a perspective that bipolar is a mood disorder. That means it's a disorder that affects how you feel. And most times bipolar is a mixture of two extreme mood states. So that's why it's called bipolar. Bi means two, and then polar means two different poles. And so it's the end of the poles. The one of the extreme mood states is actually the manic state, and the other is a depressive state. So when we look at bipolar, it's just simply a manic depressive disorder. So that means a person could have a state where they are manic. Manic simply means, well, in simple terms, having a state where you have a lot of, you're excited, overly excited, energetic, a lot of ideas. It's just like somebody just infused some juice in the person, and then it's usually extreme, but you see that manic state, and then you now have the depressive state where it looks like they zapped everything away from the person. So the mood is low, they are withdrawn, they lose interest in things they used to love doing before. In some cases, it could even lead to suicidal thoughts, feeling hopeless, feeling helpless. Of course, when you compare this to the manic state, it's almost like the opposite. So you could think that you're the best thing to happen after fried rice or after agege bread. When you're in that manic state, you just think nothing can stop you. The world is yours, So when you think about bipolar, it's just someone having these extreme states at different times, or in some cases at the same time.
Okay, now here comes my curiosity. What happened in between? How do you go from feeling so superhero to being so under the word?
Well, so what happens in between can be determined by a number of things, right? So let's assume that the in between is, the state without these episodes, right? So it's the normal state. It's the normal you, the normal perception of yourself, the normal you just seeing the world the way it is. But when these episodes happen, and in some cases, it can even become chronic, such that the frequency happens so much. So the frequency is increased that you are likely not even able to recognize the in-between, anymore. But the typical thing is that the in-between usually is the normal you without the episodes. And then you have then the extreme episodes, situations where you are either high there or you are low, very low there. And maybe when we talk about the factors that trigger bipolar or precipitating factors, we can then look at how people can get to those states.
I mean, I know you're a psychologist, but I didn't know you were clairvoyant, because that was what I was going to ask now, the triggers.
Okay. So there are a number of factors. And so let me start with the early onset, which typically can be diagnosed in teenagers and then young adults, right? And so we say it usually would start around that time. And with that, the major triggers for that is usually trauma and stress, right? Significant life stressors and then traumatic life experiences. And to be honest, I have seen that there's a strong connection between trauma and most other mental health conditions. The question now, the debate for many people is, what is trauma? And people think that people are hiding, behind the mask of trauma. But the reality is that when we talk about trauma basically means different things to different people. Trauma is anything significantly distressing to the person. So what is trauma to me might not be trauma to you. What is trauma to an African might not be trauma to an Asian. And so it's difficult to start to say, I want to have a unified definition. So typically when a person, a teenager or young person, experiences significant life or distressing life events, which we can term traumatic life events, that could be a trigger. That doesn't mean that, if you experience life significant, you immediately will have bipolar. No, because there are other disorders that can also surface. But bipolar is one of the things that could be affected, that could lead to that. And I see a consistent, pattern.
No.
Hello? Hello? Can you hear me?
Hear me? Well, I can hear you. I think you're frozen.
I can
Are
hear
you
you.
back now?
Yes.
Yeah.
Okay.
Thank you. All right.
Okay.
So you were talking about trauma in teenage years, I think.
Yes, and then young adulthood. And I think that's the major factor. Now, the other factors could include the presence of other mental health concerns. It could also include physical health conditions. It could include substance use. It could also include genetic factors. That means that if there's somebody in the family who has had it, there's a likelihood that they could pass a genetic code to the individual. But with all genetic predisposition, so that we don't leave here thinking, my grandfather had something that looked like bipolar, so it looks like I might have it. With all genetic predisposition, there is always the need for stressors, right? Stressors to trigger the genetic code. So having a genetic predisposition doesn't necessarily mean that you break down with the disorder. There has to be some trigger that brings that up, right?
Thank you very much for that explanation. Now, if you're tuning in for the first time, you're listening to Soul Food on Smooth 98.1, and we're talking about bipolar disorder. My guest is clinical psychologist Chris Abojei, and in the course of listening, if you have any question or you would like to clarify something, the WhatsApp line is open, and WhatsApp is 0809-444-0981. Again, WhatsApp is 0809-444-0981, while the call line is 01-448-9981. So according to the data, I think something I found about the World Health Organization when they were detailing different mental disorders, according to their 2019 report, it said that 40 million people experience bipolar disorder, and that the risk of suicide is high in people with bipolar disorder, with about 15 to 17%. But that is not even my concern about the suicide. I'm more concerned about the data. because it looks like it's, for the lack of a better word, relatively more common than people might pay attention to. So, in a country like Nigeria, how would you describe the prevalence? And not just that, I further saw that it was a bit hard to diagnose because, according to something they said, it can be challenging because, on the one side, it might be a little bit hard for you to distinguish between depression and bipolar disorder. On the other side, if a person has a psychosis as a result of maybe, I don't know, extreme trigger, then the person could be misdiagnosed as schizophrenia. And I'm thinking, okay, what exactly is going on?
Well, yes, very, very correct, actually, very correct. It's bipolar is one of the disorders that might take some time to be able to effectively diagnose, especially because, like we said, you need the presence of episodes to the manic episode as well as the hypomanic episode, which is a milder form of mania, and then of course the depressive episode for you to be able to diagnose it. So if a person presents just with depression, the first presentation, it's difficult to say, hey, this is bipolar. You're probably going to give them depression as the diagnosis, right? And so you probably wait again until you see them again presenting with different symptoms, and they come again and maybe they now present with manic episodes. Now, because you have seen the depressive episodes before, and now you're seeing manic episodes, you can then say, okay, this is bipolar. But the challenge with that is that you might not be the one who saw them the first time. And they might not be able to explain what the person actually saw, what the diagnosis was. They just say, yeah, I saw one doctor. I don't know what it is, you know. So now all you have is just one information or set of information to make your diagnosis. But most times, if what the person presents is the manic episodes, most times you are able to say, okay, this is a bipolar 1. Especially if those manic episodes are also presenting severely with and also with psychotic episodes or symptoms. So you can say this is a bipolar 1 because so there are different types of bipolar, by the way. So bipolar 1, the manic episode is like the major thing that you look out for there, but you still have depressive episodes. Now with bipolar 2, on the other hand, you have the depressive episodes, and then you have the hypomanic episode, which are more of a milder form of the manic episodes. The difference between bipolar 1 and bipolar 2 is not in severity, actually, is that both of them can be equally severe. The difference is that the manic episodes that present in both of them are different. So in bipolar 2, you have more of hypomania, which is a milder form of mania. And then in bipolar 1, you have more of the manic episodes that can also present with psychotic symptoms. So it's challenging, actually, because like you said, it could be misdiagnosed, you know, as schizophrenia. Maybe what the person sees is mostly of the psychotic symptoms. And it's, this is schizophrenia. Sometimes maybe it's an early onset schizophrenia. So they think maybe it's not enough to give this person schizophrenia. So this is bipolar. Only for them to present 2 years later and realize, no, this is schizophrenia, you know. So we can keep on going back and forth. And so that's why you see that, you know, contrary to the statistics that you saw, in Nigeria, the prevalence seems a little bit lower than that. And I think the problem is because people don't present. When they present, they don't present with accurate information. So as at 2008, which of course I don't have the current data, the prevalence in Nigeria was as low as 0.1%, right? So yeah, it was as low as 0.1%. Again, many factors, like I said, misdiagnosis, people not understanding, people first going to Orioke first before coming to, you know, the professional, and so on and so forth.
Or people just thinking, when I have money, I'll be fine. Or
yeah. Yes. And then something else that crossed my mind was that because sometimes the manic episodes could be enjoyable, right? So think about it. Imagine you suddenly wake up and you think you're the best thing to happen after fried rice or after agege bread. You wouldn't consider that a disorder. And if you were working and you suddenly come to work with a lot of energy, a lot of ideas, your boss would probably even love you. And you would enjoy the attention you get from the people, because when you speak with them, they're like, that guy is so bright. That guy is so, you know. And so most times when I talk about this, you know, in workplaces, I tell them that, see, when there's a switch in sudden increase in productivity, don't just assume that this guy has become a star guy. Investigate. It could be something else. So yes, it's enjoyable for some people, and that's why they might not present, until it starts to affect their life significantly, right? Because most times when it's enjoyable, they don't even see how it affects their life, and that's a challenge as well.
Now, this is a little bit different from the question I was going to ask, but it was triggered by what you just said. I think I saw somewhere that I said people diagnosed with bipolar, or maybe not even diagnosed, are more inclined to use drug. And I think, so does it mean that a person who woke up feeling this good and after a while it dissipates and they want to get themselves back to that place, does it mean they're more inclined to say, hey, what can get me back to that euphoric state?
Yes. That is an argument. It's an argument that if you suddenly notice that you in that high spirit and suddenly you drop, that could predispose you to say, hey, I want to get back to that state. And substance use could be that thing. But I think another argument is that being in these episodes, especially the manic episodes, can affect the person's rational reasoning. So your ability to actually, rationally analyze risk, analyze situations could be affected. And so the person might not be able to fully comprehend the dangers of substance use, right? But we also see consistently with your arguments that not just with bipolar, with most or some mental health conditions, is that people use substances to mask the symptoms. So when they are experiencing a mental health concern, they might turn to substance to mask the symptoms. I think the other thing that it might also result to beyond substance is also religiosity as well. We see people who use religiosity to mask the symptoms because, again, it could be distressing actually experiencing this up and down kind of moods. So people might turn to substances and turn to other coping mechanisms.
Okay, please let me take you back a bit to the different types of bipolar. You said that one is not milder than the other. So now I would like to know what determines each type or the type a person presents with.
So what determines mostly is the presentation of the symptoms, right? Like I said, so we would usually class bipolar disorder into 4 general types. You have the bipolar 1, like I said. Now with bipolar 1, you have one or more manic episodes. Now the key word there is the manic episodes, which is a more, let's say severe form of this episode. The other with bipolar 2, what you see more is hypomanic episodes. So when you hear the word hypo, it's still manic episodes, but a little bit lesser, right? It's not as severe as the other one now, but that is the only not severe part of it, right? However, the effect of or the impact of bipolar 1 and bipolar 2 could be equally severe and equally distressing. The only difference is that the presentation of the energetic episode for bipolar 1 seems to be more, and bipolar 2 seems to be less. So you are likely going to see more presentation of depressive episodes with bipolar 2 and more severe manic episodes in bipolar 1. You then have, and so in bipolar 1, people are likely going to have symptoms severe enough to keep them in the hospital or to get them hospitalized, right? Because some of these symptoms could also present with psychosis, which means they could have delusions. They could, like I said, they could have thoughts that are not based on reality or beliefs that are not based on reality. They could have faulty perceptions. Maybe they're hearing things and seeing things that other people cannot see. These are presentations that you can see with bipolar 1 and might not see with bipolar 2. Then you also have the unspecified bipolar disorder. Now, these are the ones that could be the result of other factors. Like you mentioned, substance use. That means that this person might start to use a substance, and the substance can then trigger some of those symptoms. Or they experience a major life event, and then that triggers this symptom. Or they have a diagnosed health condition, and that triggers the symptom. So it's not specified like the bipolar 1 and bipolar 2 because it could be triggered by a number of other issues. And then you have finally the cyclotemic disorder. The cyclotemic disorder, I usually just, to make it simple, I usually call it the chronic disorder. Chronic simply means that, you might have these symptoms, the depressive and the manic symptoms mildly presenting for up to a period of 2 years. So these people are more of the functional guys. They are able to still get up, do work, just go about their daily life, even though these things are there from time to time, but they seem to find a way to just cope, right? So you might not be able to diagnose them with bipolar 1 or bipolar 2. And so you probably need to observe them for as much as 2 years before you can give that kind of diagnosis. But however, in teenagers and children, you don't need up to 2 years. You might need just 1 year to be able to give the diagnosis. So these are the 4 different types of bipolar, right?
I mean, there are a number of things I just want to understand. Children having bipolar disorder right from childhood. Because now, if I am to classify some of the things I've heard from you as risk factors, you mentioned trauma, I think other medical conditions, as well as substance abuse and use, genetic factors. What's the earliest age a person can be diagnosed?
Well, so diagnosis in children is not so common, right? It's very rare, actually, but it does exist. However, you'll see more of the diagnosis in teenagers and young adults. So usually in, say, early 20s, and then for teenagers, as early as 12, right? But most of the diagnosis that we get usually would be in early adulthood. That's early 20s, upwards. Now, rarely we do see, cases of children, that means below 12, being diagnosed, but it's very, very rare. I think another factor is that you probably would need to consider a lot of other diagnoses that are more suitable to childhood before even considering bipolar, before considering bipolar disorders. Yeah.
Okay, so right after this, we'll get into the treatment or the management, because I understand it's lifelong, right?
Well, just like every mental health condition or illness, so when we say it's lifelong or it's chronic, it doesn't necessarily mean that you have been sentenced to this. It simply means that you have to create a lifestyle that you maintain for the rest of your life, right? And think about it. If you want to be healthy, you create a lifestyle that you maintain. If you create a healthy eating lifestyle or diet lifestyle and then change it next year, it makes no sense. So the idea with managing mental illnesses or mental health concerns is that you create a lifestyle intervention that helps you remain, healthy. So it's chronic, not because it's severe, but because you have to manage it for a long time.
Okay, we'll get to have that take when we come back after this. You're listening to Soul Food right here on Smooth 98.1. Oh.
Can I have a MasterCard restaurant with menu? I'll have the assorted meat platter and smoky patty jollof on the side.
Only you wants to eat all of this.
I beg, it's restaurant week, and I must not let these great news pass me by.
You didn't tell me now. From 6 to 26 November, explore the world of flavors during the MasterCard.
All right, so when we come back, it's just the management or any other recommendation and
to see the list of participating
any, I don't know, are there myths that are stereotypes that are surrounding bipolar disorder, especially in Nigeria? I mean, aside the one I mentioned, that's the one that comes to mind. Like when you have fluctuating moods, they just say, the show bipolar, and are you bipolar?
Well,
So
I think the other additional myth is that people could confuse it to being possessed. So imagine all of a sudden you have this high and all of a sudden you have this low, like, see, this guy, something is happening, maybe the person is being possessed. So during those, and of course, imagine if you're presenting with psychotic symptoms, in the manic episode. So you are hearing things, seeing things. So people might think that they have gotten the person from the village, and so that's a very common myth that you see with bipolar. I think go on. Sorry.
No, well, that's coming.
Okay, awesome.
Love music and love life. You're listening to Soul Food on Smooth 98.1, and we are discussing the topic of bipolar disorder, understanding bipolar disorder. Well, we hope that with our viewpoint and explanation, you have come to a clearer understanding of the subject matter and you are better enlightened on it. Now, let's talk about, before we even go to the management, I think behind the scene, we're talking about some myths that are surrounding bipolar disorder. I mean, the one that easily comes to me is once a person has mood swings, of which mood swings are normal, right? So once a person has mood swing and people around you maybe have heard of the word bipolar disorder, just easily say, yeah, are you bipolar or something like that? But aside that, are there other myths that surround bipolar disorder?
Yes. So beyond the mood swings myths around bipolar, there is also the myth that the highs and the lows, that means the manic episodes can occur in regular cycles. So people think, you can accurately predict it. But while we actually encourage clients to study the mood, it might not be that predictable sometimes. I think another myth is that it could be the result of demonic possession, right? So village people have suddenly caught hold of the person. But that's not true. It has nothing to do with being possessed by demons. And I can understand why people say that, because if a person is in a manic state where they are probably having psychotic symptoms, they are hearing things or seeing things, people might think, they have gotten them. Now, funny enough, as part of the religious myths, is that some people in some cultures, and even I think today, could also misunderstand the bipolar to mean that the person is gifted spiritually, right? Yeah. In fact, you might not know it, but let me not say a lot, but some of these prophets that we see all around could actually, meet the diagnosis for bipolar. Especially when they are in that manic state and they are seeing things and hearing things and, making it look like it's a prophecy or it's a vision. You might have seen a lot of videos circulate where people come up with stories about how they were in the marine kingdom for years, how they were the second in command with the devil. Those could be clear symptoms of bipolar if you investigate, or in some cases could even be psychotic symptoms. So those are some of the things that the myths. So people think I now have some power, or I'm now possessed by the demon. And then I think the last one is that some people think there's no treatment, or you cannot be treated or managed. So it's almost like once you have it, you have it. You can't treat it, you can't manage it, and that's not true. So maybe that would lead us to
exactly
the treatment and the management. So with bipolar, typically the treatment of bipolar is a mixture of chemotherapy and psychotherapy. That means medications, the use of medications, and of course the use of psychotherapy. Most times the medications are introduced to create a balance with the neurotransmitters, because sometimes we've seen that when the person has an episode of has bipolar, there could be some imbalance in neurotransmitter secretion or functioning, and so introducing antipsychotics in some cases or mood stabilizers in some cases can actually help to create that balance. But then you also have psychotherapy, which I think is a more long-term approach. And why do I think it's a more long-term approach? So no one replaces the other. Let me emphasize that, right? So it's usually a combination of both. But the reason why I say that psychotherapy is a more long-term approach is because beyond just taking the medications, the individual must learn to understand their symptoms, must learn to understand their triggers, and also learn adequate coping mechanisms to manage it. And I think that the biggest aspect of the of psychotherapy is that it helps the individuals manage their perception of the illness. Because sometimes the biggest struggle I see with my clients is that they struggle to even accept the condition, right? They struggle to accept the condition. In my experience, one of the things that I've done with clients is that I help them see the disorder differently. You know, in some cases, I could even come up with a narrative that this is like a superpower. And I help them see how when they're in a manic state, they tend to have a lot of ideas. They tend to be more creative. They tend to, you know, look like superhuman. And so the idea is sometimes, and I see a pattern, the pattern for some people, not everybody, could be that when they're in that high state, they have a lot of ideas. They want to conquer the world. And then they start to do so many things all at once. And they realize that they cannot finish all those things. And they start to reflect over it and might find themselves slip into a depressive state, right? So in that situation, what we then do is that you help them understand themselves a lot better. So self-awareness comes in. You know, one of the things that I've done is that I then help them see that you don't have to execute all the ideas that you have, right? So if you start to have a lot of ideas, now you know that, okay, I might be in a manic state. So what I need to do is to test my ideas, write them down, for example, pick one of it and discipline myself to stay on that one idea, right? And if I can do that consistently, I might find that I'm able to effectively execute that idea and then maybe come back to the next one. Or maybe when I'm coming back to the next one, I then realize that, okay, maybe that was not a sound idea, right? So that's basically what therapy would do for them. It's helping you understand yourself and helping you function effectively despite these symptoms being present.
Well, I can say thank you for helping us understand bipolar disorder. It's been enlightening. Thank you for your presence always. What will be your final thoughts, recommendation, advice? I don't think we got to prevention. Can you prevent bipolar disorder?
Well, healthy lifestyle. We can reduce the tendency of breaking down. If you notice what I said when we started, that the major triggers beyond the genetics and all the others are trauma and significant life stressors. So if you create a healthy lifestyle to manage these situations and learn to seek help when necessary, you might be able to prevent the likelihood of breaking down with any disorder, including bipolar disorder.
Thank you very much. And on that note, we've come to the end of Soul Food for today's. It's the last Saturday in the month of November 2023. Next month, we go again, educating you on your health and wellness. I think on social media, you have not changed your username, right?
No, I haven't. It's still Chris Abojei.
Exactly. So you can find him on all social media, Chris Abojei. Thank you for listening. You know, you can find the YouTube video on YouTube. That is youtube.com/smooth921 FM Lagos. And thank you for your presence again today. It's a pleasure.
Thank you. Thank you for having me, as always. Bye.
All right. So, you know, we will soon go over to the corner of the kids where it will be spelling, brain teasers, puzzles, and so much fun on Curious Minds on Smooth 98.1. That will be in about 5 minutes, right on Breakfast in Bed. My name is Oluwaseun, and you have to stay with us.
And the best will follow.
What is